Hello, my name is Brisa Baez-Caballero, and today I will be speaking about liposuction. What is liposuction? Liposuction is a surgical procedure that is used to remove fat deposits from various areas of the body. The areas that liposuction is mostly performed on in the abdomen, hips, inner and outer thighs, flanks, love handles, inner arms, and even buttocks. To be a good candidate, one must be that you should be over 18, must be a good candidate and have good general health. You must be within 30% of your ideal weight, and you must attempt or at least try to take a good diet and try to exercise. You also must stop smoking. Smoking can sometimes speed up the recovery process in any type of surgery. Most of the time, uh, f- uh, there are various types of liposuction that can help remove fat from the body, but usually doesn't respond to diet or exercise. When preparing for liposuction, you usually get referred to a primary care physician, which is most known as your PCP. You get referred to a PCP due to the fact that you have to be cleared for surgical or for any type of surgery. And that's for any type of patient, any type of surgery you're going to perform, any type of procedure. The patient is referred to their PCP. The PCP, what they usually do is send the patient out for lab work, perform EKG. Sometimes they even ask for stress tests. When we perform the EKG, if a patient's EKG comes back abnormal, the patient must be referred with a cardiologist. The cardiologist, what they will do is examine the patient. They'll see what diagnosis or heart problems they have. If a patient has hypertension, if the patient has low blood pressure, anything, the cardiologist must clear the patient before having surgery. Once the cardiologist has cleared the patient, we have the okay to sign the form that the patient is able to go back to the surgeon and tell them that they have been cleared. Another thing that the doctor or the primary care physician will do is that they will stop any medications that are blood thinners, anti-inflammatory drugs, anything like that, due to the fact that patients who drink these medications when having surgery or at the moment of having surgery, the patient must bleed or can or might bleed excessively due to the blood thinners. Another thing is that the cost of liposuction. Liposuction could be very expensive, but is something that is affordable for every person. The cost of liposuction usually varies from $1,000 to $10,000. The thing is, or some of the important stuff you must know, is that from that amount of money, it only covers the surgery. It doesn't cover any complications, if you have to stay overnight, if you have to pay any other expenses, but it only covers the surgery. Another thing is that in Texas, liposuction has its pros and cons. Another thing is to know that is very important is that liposuction is not a permanent surgery. You can regain the weight they have just removed due to the fact that if you suffer from obesity, if you suffer from any type of problem, that my thyroid problems, it could always come back. Fat will never be permanent. Another thing is that liposuction, what it does, it's contouring the body. What this helps a person do is feel more confident about themselves and helps them gain a better self-esteem. Another thing is that it helps remove any excessive fat that exercise could have never done. For example, if you have any belly fat and you just want to remove it, you go for liposuction, they remove it, but it's not a guarantee that the weight you have just lost could come back. Now, as I end my speech, plastic surgery does not have its or has its pros and cons, and that's the reason why many people nowadays do these types of surgery. Many people like going the fast way instead of going through exercise, diets, and all these things that there is in the world, but they decide to go through the easiest way, which is liposuction. Lastly, liposuction is viewed as one of the most often plastic medical surgeries that there has been done in the United States.